Have you heard of Sjögren's? If you haven't, you aren't alone. There's a lack of awareness in the general public, and even among some in the medical community, around exactly what Sjögren's is. We also know that many people have never heard of Sjögren's, even though it affects upwards of 4 million Americans. And the result is that many Sjögren's patients who present with the classic symptoms of dry eye, dry mouth, fatigue, and joint pain often go undiagnosed for upwards of 2.8 years. Education and information is an important starting point to move awareness and treatment forward. We asked a team of medical Sjögren's experts to explain what Sjögren's is.
Sjögren's is a chronic autoimmune rheumatic disease, and we think of it as a cousin to lupus or rheumatoid arthritis because there are a lot of overlapping clinical and serological manifestations. But in this case, the body's immune system attacks the moisture-producing glands. So some of the most important symptoms are dryness, like dryness of the eyes, the mouth, and other parts of the body. And like other rheumatic diseases, it causes inflammatory fatigue and joint pain and muscle pain, and can also affect the internal organs. So virtually any organ can be affected.
Exactly how to diagnose Sjögren's has been an ongoing conversation and debate among medical professionals.
Yeah, diagnosis of Sjögren's can be a great challenge because there has been disagreement over the years as to what we should call Sjögren's, what criteria we should use to classify or diagnose Sjögren's, what tests should be used, and what the definition of an abnormal test really is. At the present time, it's recommended that a whole variety of tests be done because Sjögren's can affect so many different parts of the body. So we do tests to look for objective evidence of dry eyes. We have tests to measure the production of tears, which can be deficient in Sjögren's. We have tests to look for damage on the surface of the eyes as a complication of dry eyes, which is a common manifestation of Sjögren's. We do tests to look for objective evidence of dry mouth. Sjögren's causes significant dry mouth, decreased salivary flow, so we now have the capability of measuring salivary flow. We can also use imaging studies to look for changes in the salivary glands that indicate that something is wrong. And finally, because Sjögren's is an autoimmune disease like lupus or rheumatoid arthritis, we have tests we have to do for autoimmunity. Sometimes we find antibodies in the blood that are markers for the disease, and they can greatly help us make a diagnosis when they're present. In other instances, when the antibodies aren't present, we may do a small biopsy of the salivary glands to look for inflammation, which is one of the hallmarks of the disease. So it's really a combination of tests that must be taken as a whole and considered before an accurate diagnosis can be made.
The dryness symptoms for Sjögren's patients are often misunderstood or trivialized.
Just starting from dry eyes, I've known people that had to change their careers because of the severity of their dryness of their eyes. Having pain in your eyes 24/7 is a major quality of life. And I think unless you're an ophthalmologist or an optometrist, at least my group of physicians, I think, don't get it, how bad it is. Same with dry mouth. People can lose all their teeth if it's not recognized what's going on. Now, and the sad thing about that is we can prevent that if we know, and just with some simple things. So I think, another area where, awareness is so important among healthcare professionals.
For most patients, Sjögren's does not stop with just the dryness symptoms. Other organs are often affected, presenting a more dangerous and complex condition to manage.
Beyond the dryness, of course, there are, it can affect any body organ or system. So I've always had a lot of peripheral neuropathy and pain, so where sometimes I couldn't feel my feet. That affects being able just to go out and take a walk because I really have to focus on my feet and where I'm stepping because I can't feel them like regular people can feel their feet. The fatigue. The fatigue is not the tired that somebody else says they are, but it's just this bone-crushing, toxic, overwhelming, all-engulfing kind of fatigue that is really hard. You can't necessarily push through it like you can, like I could before I had the Sjögren's. So someone might say to me, I might say, oh yes, I'm tired today. And they might say, oh yes, I know just how you feel. I'm tired too. I ran all these errands and then I went to the mall. I am just so tired. And what I want to say is, no, you don't get it. You don't get it at all.
Rather than treating Sjögren's globally in a patient, the approach of many physicians is to deal with the localized challenges and symptoms, which can vary widely from patient to patient.
What I like to do, Steve, is divide the body into three parts: the eyes, the mouth, and the internal organ manifestations. And so usually the eye care provider, a cornea specialist, an ophthalmologist, an optometrist will help us get started with treatment for the eyes. For the mouth, we ask patients how much their symptoms bother them, whether they've had any complications like cavities, mouth ulcers, burning mouth. And so if they do, we give them replacement therapy with artificial salivas. We can coat the mouth with a variety of lubricants and gels. But I think our most effective treatments of all for dry mouth would be medicines. Medicines called secretagogues, which help stimulate the moisture-producing glands to produce more saliva. These medicines seem to be helpful, not only alleviating the dryness, but other problems related to dry mouth, like altered taste, difficulty swallowing, difficulty speaking. And when you take them for a while, especially at the higher doses, they seem to help dryness problems in other parts of the body as well. So the patient will get tears and gels for her eyes, perhaps artificial saliva and medications for dry mouth. And then the treatment for the internal organ manifestations really depend on what the manifestation is. If it's fatigue, we have medications for that, like hydroxychloroquine, that can be useful. That same medicine is very effective, in my opinion, for treating musculoskeletal pain and arthritis. If it's a more serious problem involving a vital organ, then other stronger medicines called immunosuppressives are often used to treat these more challenging manifestations.
At this time, there is no cure for Sjögren's. While critical research and clinical trials for a therapy are ongoing, this is a condition that both the patient and doctor have to work together on to manage the symptoms and lessen the impact of the disease on a patient's life.
Sjögren's is a life-altering disease, and a doctor who may look a little bit further and identify that whatever they're dealing with, whether it be a GI specialist, a rheumatologist, a dentist, an eye care professional, have an opportunity to tremendously impact the quality of life for a Sjögren's patient by recognizing that this is part of a bigger picture. Many Sjögren's patients spend a lot of time wondering about their own mental health because they have so many different maladies that are occurring that they think it's in their head. And once you're able to identify that all of these disparate things that you're experiencing actually fall under one umbrella is very comforting. Even though it doesn't provide an instant solution for it, it helps to explain a lot. It helps them, gives them comfort, it gives them reassurance.
Although each Sjögren's patient's symptoms and complications are different, Sjögren's often forces a patient to drastically change how they live their lives.
And I look at Sjögren's as like life on a roller coaster, but it's like a roller coaster that you can't ever get off. You know, there's no exit. It doesn't let you off it, you know, at some point. So you're always going kind of up and down and just trying to find ways to cope with it, but it changes your life forever.
Sjögren's is a life-altering, complex disease with serious complications and challenges. But progress is being made in both the speed of which Sjögren's is diagnosed and the options patients have for treatment. The ultimate goal is a better quality of life for all Sjögren's patients. And although there is a lot of work to be done, the good news is we are well on our way towards achieving that goal. For more information about Sjögren's, receiving a Sjögren's diagnosis can often be daunting, but at the same time give some relief, knowing that you finally have an answer to all of your symptoms. Along with the symptoms of extensive dryness, Sjögren's other serious complications include profound fatigue, chronic pain, major organ involvement, neuropathies, and lymphomas. Sjögren's has many facets, and often new patients can be overwhelmed by all the information. We spoke with current patients and their physicians to learn more about how they've learned to cope with the challenges and understand the complexities of Sjögren's. Here is what they said.
I think I had a very common reaction of, hallelujah, we know what this is, now I can be fixed. And of course it takes some time to learn that you indeed aren't going to be fixed and go back to normal, but it was a relief that I had something to work towards.
Due to the health challenges with Sjögren's, patients often are forced to take a step back and evaluate their lives, careers, and future.
The Sjögren's definitely affected my career because I had a career that I was very passionate about, and that career ended. There was no way I could work 7 days a week around the clock being a reporter and a producer and putting together stories. It was a very high-stress job and very intense time-wise. And so I took a step back to focus on myself and see what I could learn about Sjögren's and see if I could get stronger.
In Sjögren's, the body is mistakenly attacking its own protective system by targeting cells, tissues, organs, and other body systems that it sees as foreign.
You recognize yourself as foreign, and in Sjögren's specifically, the little white blood cells that should be going to areas to clean up damage enter into those tissues that produce fluid in your body. And so certain glandular tissues, like those that make saliva and those that make tears, become filled up with those white cells that are trying to fight something, but that something is not something foreign, that something is you. And I also tell them that those little white cells don't just stay in those glands, but they have the ability to go to other organ systems and create an inflammatory response. And unfortunately, that a small percentage of patients with Sjögren's may have those white cells that continue to be very aggressive and become abnormal and can develop something called lymphoma.
Sjögren's can often be trivialized by friends and family as a little dry eye and a little dry mouth. But as a systemic disease that can affect every body organ and system, Sjögren's is a much more serious and complex disease.
First of all, I can tell you it's very devastating to have dry eye and dry mouth. With the dry eye, it affects how clearly you can see. You've got eye pain all the time. You get frequent eye infections. You have the fear of getting a scratched cornea if you don't understand how to prevent that and treat that. With the dry mouth, you get rampant caries, you get crowns, your teeth chip and they crack and they break. It's hard to talk for long periods without the moisture. You can get oral infections. The oral infections are painful. It's really hard to eat. And beyond the dryness, of course, there are, it can affect any body organ or system. So I've always had a lot of peripheral neuropathy and pains.
Patients who live with Sjögren's often see an average of nearly 5 different specialists a year to treat their various manifestations due to Sjögren's.
So the other thing that's interesting in sharing with friends and family, and you start listing all the things, and they're just kind of looking at you because how could one person have that many things wrong with them? Just, okay, you got the joint pain, you got the fatigue, and then the burning skin and tingling because you got the neurological things that are going on, you got cognitive things that are going on, and oh wow, she doesn't really communicate as smoothly as she used to.
Having loved ones understand Sjögren's can be a challenge. In addition to all of its complications, it is thought to be a rare disease. But it is far from rare, as it affects 4 million Americans. And of those 4 million, 90% are women and 10% are men.
But I'm also a guy, so it's also rarer for guys to get Sjögren's. But so, here I am, I'm one of those people.
Sjögren's is a life-altering disease where patients often must change their lives as they navigate the new world of having a chronic autoimmune disease.
Having Sjögren's means many, many losses. We lose our relationship, having the same kind of relationship that we had with family. We lose some friends, good friends, because of it. It affects our relationship with colleagues. It just is this insidious and infiltrates just every aspect of our life. So I look at Sjögren's as a thief because it stole my life from me.
Patients must find new coping mechanisms for dealing with not only their symptoms, but also the emotional, financial, and social aspects of living with Sjögren's, including the fear of what may come.
It can be fearful when you hear of some of the complications that people have. When you get a new symptom and you don't know if this is something that is just, okay, am I getting old? Is this just a new symptom? Is this something that everybody has? Or is this the start of something else?
Sjögren's can affect all ages, from children to adults, and with that comes different struggles and concerns.
I absolutely am fearful that I know that more complications can arise. So I worry that in terms of taking care of her, or if we want to have more children, or just what may come my way, I guess I'm nervous what that might look like, because I'm at a disadvantage in comparison to those who might not have an autoimmune disease.
With autoimmune diseases running in families, Sjögren's can often be found in more than one family member.
The most fearful thing would be, I didn't think about it till just recently, but my granddaughters could be diagnosed with Sjögren's.
Sjögren's patients often fight their disease silently because they don't want others to judge them based on their diagnosis.
I think the differences seem to be just on the patient, depending on the personality or, again, the predisposition. Right? I don't talk about it a lot. Again, you asked the denial question. I'm not at all in denial about it, but I don't talk about it because it doesn't define who I am.
Acceptance of having a chronic autoimmune disease is a first step in starting to take your life back.
And I like to say that I don't want Sjögren's to define me. I don't want it to define who I am, but I have to accept that I have it and also learn to work through it.
Sjögren's affects the entire family, and having the extra support along the way from loved ones can help patients considerably.
Some days are really tough, and some days are more easier to manage. So on the days that are really tough, I know I got to step up my support, and on the days that are easier to manage, then I can let her go and do what she wants to do.
Sjögren's patients often struggle to find ways to help their friends and family understand the disease.
So many of us look just fine, and so it's hard for people to believe that we're suffering as much as we're suffering. And so one of the most frustrating things for me as a Sjögren's patient is that it's so easy for other people to label me as unwilling to participate, label me as unenthusiastic, label me as lazy, or label me as a hypochondriac.
It often takes time for a patient with a chronic autoimmune disease to come to terms with their diagnosis and be willing to share with their loved ones.
You know, if you have something going on and you don't talk about it, I think it creates distance between people, family, spouses. So I think it's okay to talk about it, and I think it's okay to say I'm not feeling 100%. Right? You know, everybody's entitled to have a lousy day, and that could be part of it.
To help those around them and to help increase awareness of Sjögren's, patients need to share the challenges of living with Sjögren's with their family and friends.
I think it's incumbent upon Sjögren's patients to find a way to communicate what they're experiencing. So they may not go through the whole litany of what their life is like, but come up with something they're comfortable saying so that the people around them, the doctors they deal with, so their family members and friends understand that life is not normal for them. So it might be something like, every day is a struggle, but thank you for asking. Some days are better than others, but I appreciate your concern. So what that does is alerts the person they're talking to that, in spite of the fact that they might look good, that they're dealing with something that is a challenge all the time, and that they can do that without inviting a lengthy conversation, which typically they don't want to have. So the voice of Sjögren's has to come from Sjögren's patients. And although I respect and understand their desire just to go on with their lives and stay back and not be in the forefront, it's really important to help them tell their story so that others understand, to help forward the mission of Sjögren's Foundation, and also to help their loved ones and people in their circle of influence so they have a better understanding of what life is like.